Some of the cases we have seen this time have been among people who identify themselves as men who have sex with men. We're still trying to understand the dynamics of the transmission, but for now there's some very specific advice we want to give with a community of people who are most affected at this time. So Andy, I want to hand it over to you. It actually would be interesting if you could mention the consultation you just had, and as well as what advice we have.
Thanks so much. So I think one of the things we've recognized with this outbreak, it's not typical. We're seeing cases, as you say, among men who identify as gay, bisexual, or from other groups of men who have sex with men in several countries, often linked to travel, or recent travel. And it seems clear, as Rosamund was saying, that this is linked to close contact. So this could be through social contact, possibly through sexual contact, which of course is close contact. We're still in the early days of this outbreak, so there's a lot we're still learning. But the communities themselves are clearly, number one, concerned and really keen on getting accurate information to help them understand risk and how they can manage the risk. And number two, they're really keen to make sure that information is proportionate and fair, and there's a lot of stigma and discrimination that surrounds many diseases. And I think the key thing we need to look out for is, as WHO, to work with our partners in communities and elsewhere to make sure that the messaging is correct. So while, for example, we're seeing, some cases amongst men who have sex with men, this is not a gay disease, as some people in social media have attempted to label it. That's just not the case. Anybody can contract monkeypox through close contact. We know as well in WHO that when we want to be responsive to an emergency or to an outbreak, in addition to really working with the experts, tracking the epidemiology, we need to work with communities really from the beginning. And so today we convened an initial meeting of members from the affected communities from all WHO regions, including some representatives from Nigeria, so from endemic settings as well as outbreak settings. And it was a fascinating and timely conversation. We had really sound advice shared, which it can be equally as helpful to us in managing and leading in the response as the science and the data. So we need to really bring the community perspectives together with the science. It's early days. We've got goodwill from the communities. They want to work with us and understand how best this can be contained.
Just to understand, Andy, you talked about that it could be spread through sexual contact, but it's not a sexually transmitted disease. Can you just clarify that for us? Because I think it almost sounds like the same thing. If you say sexual contact, it almost sounds like the same thing to somebody who's casually listening. So what's the distinction between a sexually transmitted disease and a disease that could be spread through sexual contact?
I think that's a great question. I think many diseases can be spread through sexual contact. You can get a cough or a cold through sexual contact, but it doesn't mean that it's a sexually transmitted disease. Typically, you need an exchange of vaginal or fluids or semen that has an element of contagion to it to transmit the disease. And my colleagues who are more expert in the science will probably explain that much more eloquently. But at the end of the day, I think the difference is that sexually transmitted infection is caused by by sexual intercourse, anal intercourse, vaginal intercourse, or oral sex, and you don't need to have sexual contact in order to transmit monkeypox. Close personal contact is sufficient.